Introduce yourself.
Hi, I'm Dr. Stephanie Prado. I'm a vet here at Santa Monica Pet Medical Center. I pretty much was born and raised here in LA, California. I always lived in Koreatown. So for college, I stuck around and I went to college at Cal Poly Pomona. I was there until I finished my undergrad. And after that, I actually took a bit of a break from the vet field. Did a little work in hospitality. Then I decided, okay, I have to go back to school. And so when I applied to vet school, I ended up in Sydney, Australia, and went to Sydney Uni, which was an amazing experience. Would definitely recommend and do it again. I was there for about 6 years. After I finished school, I stayed there to work for a little while before finally deciding to come back to LA since it is home. And I have now found my family here at Santa Monica Pet Medical Center. Why did I choose this profession? It's because I always loved animals. I had kittens, puppies, rabbits, birds growing up, and from a young age, I just always knew that I wanted to do what was best for them and take care of them. And especially when they were sick, I was young and I was like, I don't know what to do. So I wanted to know what to do. And so here I am. So now my house is still pretty full. I have 3 big dogs, 2 cats for now. And yeah, I'm always looking out for another cat. But what are my personal hobbies? Well, as I said, I have a full zoo at home, essentially. So spending time with the animals, of course, especially my cat Asta, because he is the most needy and always wants me around. But aside from that, I mainly enjoy, going to the beach, going on hikes. I love K-pop and K-drama, so you'll catch me at a K-pop concert probably on the weekends if I can. Well, not every weekend, but sometimes. And yeah, I think that's about it. All right, so today we're going to be talking about dog allergies, which I know can be very annoying because an itchy dog is very uncomfortable and it is just not fun for them or for us. So when we think about itching, there's 2 main reasons that we want to be looking at. 1 is parasites and 2 is allergies. So for parasites, we're thinking fleas, so keeping them up to date on flea and tick prevention is ideal, especially here in California. In LA, it just doesn't get cold enough for fleas to ever really die off. So even in the winter, we still recommend flea and tick prevention. And so just making sure that you're giving it monthly, whether you're on an oral or a topical option, that would be fine. So that's covering one base of why your pet could be itchy. So now we're gonna get into the allergies. So with allergies, there's 3 main things that we think about, which we've already discussed: fleas. So the flea bite can be quite annoying, and so it can cause flea allergy dermatitis. So that is when the pet is very allergic and hypersensitive to the flea bite, and so they can become very itchy. They can get scabs and lesions throughout their body, and so again, keeping them on regular prevention will be ideal. And so the second thing is food. Food is technically thought to be only about 10% of the cause of allergies. However, it is one base that we can cover if we are regularly on flea control and everything else seems to be under control, but we still are getting an itchy dog. Then a food trial can be something that we move forward with. With food trials, essentially, we're thinking about proteins. So with proteins, a lot of the times it's chicken or beef that tend to be the main culprits with food allergies. So sometimes just trying out a novel protein could be enough. So turkey, venison, bison, lamb, but you do have to be pretty strict in the sense that if you are gonna think about, say you choose lamb, you wanna choose also treats that are lamb-based. You don't wanna be on a lamb-based food and then be feeding still chicken treats, because then you really might not see any improvement. And If need be, then there are also hypoallergenic diets that are prescription only. So that's something that we can discuss if you do have an pet who is always itchy and allergic. But the main thing is called atopic dermatitis. Now, this is allergies to environmental allergens like pollens, dust mites. Unfortunately, these things we just can't avoid. So regular bathing is recommended, and there are other medications that can be used as well. There is an injection called Cytopoint that can last from 6 to 8 weeks. And there is also a oral medication as well called Apoquel, but these sort of choices can be discussed during an appointment. But ultimately, unfortunately, allergies are for allergies. So it's just going to be about trying to keep things under control so that we can avoid secondary concerns like secondary bacterial or yeast infections. So sometimes when we're getting dogs with recurrent ear infections and skin infections, at the base of it all could be an underlying allergy. If you have further questions, please feel free to give us a call.